Hi, everyone. My name is Solomay Tibabu, and I'm your host for Going Digital Behavioral Health Tech. I'm very excited to have George Eleftheriou here as the founder and CEO of Feel. We're going to be talking about biomarkers and digital therapeutics for mental health. So, George, thanks so much for being here.
Thank you for having us, Solomon. It's a pleasure.
Well, let's tell our audience about yourself and what got you interested in this topic.
Absolutely. As you can tell from my very long last name, I come from Greece originally. I grew up in Athens and moved to the US almost 10 years ago for grad school. After graduation from Columbia, I joined McKinsey and I was a management consultant for a few years. And during my time at McKinsey, I was working really long hours, in many cases over 100 hours per week. And one day after a very tiring and intense project, I woke up and I could not breathe. And that was not because of COVID-19, thankfully at the time, but it was because I was experiencing a panic attack. And this was a first for me. So I didn't know that it was a panic attack to begin with. So I visited my physician. He told me that you are physically healthy, but he recommended to visit a psychotherapist. So I visited the therapist. I started doing cognitive behavioral therapy for a few weeks at the time. And after a few weeks, the panic attacks went away. But what stayed was the realization that when it comes to our mental health, we don't use any technologies, any objective measurement tools. We don't have any of those in our disposal, and we only rely on the interventions that psychotherapists or psychiatrists or clinicians overall are providing at their point of care. So that was the initial interest that I had in the space. And a few months down the road, my co-founder, that is a long time friend of mine, was visiting me in New York because he was presenting in a conference about his PhD thesis in biomedical engineering. And as part of his PhD thesis, he was using sensors in order to detect the emotional state of individuals and how those data points could actually be used in a healthcare in the healthcare world. So this immediately was very interesting to me, and we decided to start a company with the mission to bring objective data in the field of mental health, and in order to support individuals outside of the therapist office in the real world when they're dealing with anxiety, depression, or other mental health issues.
Wow, awesome. What an amazing story. So yeah, you touched on it a little bit, but why are biomarkers important in mental health and why hasn't the status quo worked as much?
In every other medical field, if you think about it, we're using objective measurement tools to measure how individuals and patients progress and how they're getting better or not. Let's take the example of diabetes. Individuals are measuring their glucose levels multiple times a day or even continuously these days. In the case of heart disease, individuals are monitoring their blood pressure. But when it comes to depression, anxiety, or other mental health issues, we really rely on self-reported patient questionnaires and the subjective to a point evaluation of a psychiatrist or a psychotherapist at the point of care. And even at that point, those clinicians do not have the whole picture, right? They only see the person at that point in time, and they don't know what happened last week or the week after. So I think that biomarkers are extremely important because they give us the opportunity to quantify mental health for the very first time. We can now, with the results that we see in our discovery studies and our already commercialized program, we can detect the emotional state of a person 24/7 by using our proprietary biomarkers, and then through that inform the clinician and the psychotherapist to help them improve their clinical efficiency and effectiveness. So I would say that biomarkers are very important because they help us better diagnose mental conditions, even much earlier than when someone would go visit the psychotherapist. As you know, the time between the onset of symptoms and when someone is receiving an intervention on average is 8 years. So what if we could intervene and understand that someone is struggling with mental health 8 years in advance before they visit a psychotherapist? That would change significantly the way that we treat these conditions, and would change significantly how much those conditions have progressed. So diagnosis is definitely one part. The second one is management of those conditions. How we're able to intervene in real time before people end up in the emergency room or back to the hospital.
Mm-hmm. Wow, exactly. That's really powerful. And you mentioned something about commercializing, and I'll get to that. I certainly have questions of how you went from you and your friend to working with health plans. But help our audience understand a little bit about what actually physically we're talking about here. Like, what does a user get? What does it look and feel like?
Absolutely, absolutely. And let me share my screen just to provide a visual of that. Uh, so basically, our very first commercialization approach is a therapeutic for depression and anxiety. We have developed a program that has a duration of 4 months. And in that program, we're offering participants a device that we have developed. It's a proprietary device that actually monitors the physiology of an individual 24/7. And then our proprietary algorithms are able to extract from those inputs information that is important for the management of mental health of those individuals. So we can detect the emotional state of the person, as well as other biomarkers that are important for the management of those conditions. And then based on that, we can intervene in real time. So through the mobile application that we have developed, when we detect that someone is going through a difficult, challenging emotional state, we can trigger real-time interventions. So let's say that you are stressed or sad. We will be able to detect that through our device, and then a notification will pop up in your phone telling you that we just saw that something stressed you out or that something made you sad. And then we will ask you to do a breathing exercise or a mood journaling exercise or a different intervention that will help us, that will help you change your thought patterns or behaviors. After that, we take this information, we provide it to a licensed psychotherapist who is part of our program. So we have a small network of psychotherapists already. And they're using this information in the weekly session that they have with the participants in the program. Before the session starts with our psychotherapists, they already know what happened during your week, and they're able to use this information in order to improve their clinical efficiency and effectiveness. So instead of meeting with the participants in a program for 60 minutes every week, which is the standard of care nowadays, they're able to deliver effective interventions in just 15 minutes because they know where to focus and they know how to steer the discussion because of the data that they have in front of them. Of course, finally, we have an educational program that we're offering as part of our solution. This is also very important because it helps individuals develop the long-lasting coping skills to improve their mental health. Our program is really a disease management program that we're offering to individuals suffering from depression and anxiety. Those individuals could suffer from a primary chronic condition, and they could have a mental health comorbidity, or they might be struggling with those conditions as a primary condition as well.
Awesome. Um, and now, who are the types of, so the individuals, the consumers are the end users using the devices and the tools. But what kind of organizations are you typically partnering with to deploy these solutions?
So we're primarily partnering with health and life and disability insurance providers. In the US, we're working primarily with health plans to deliver our disease management solution to specific populations. We have seen quite a lot of interest in the Medicaid space, especially because of the gap of access that exists in that area. But also we're working with life and disability insurers in Europe. Disability insurance is a use case that we're focusing on in Germany in particular, because the primary reason for disability is actually depression. So we are trying to prevent individuals from suffering from those conditions to reduce the disability claims for our insurance partners as well.
Mm-hmm. And just to clarify, is this mostly adults, youth, or no?
Yes, we're focusing on adult population right now.
Mm-hmm. Well, it's come up time and again throughout the conference, but just the impact of behavioral health on chronic conditions is so significant. And so great to hear that this is making a difference in that regard. And, just the stories you have about the impact that you've already made, everything from, closing that gap of the 8 years to identifying ADHD within a matter of maybe minutes is maybe a stretch, but I think that's really interesting. And if you have any stories on that front, please share. But I know a lot of health plans have asked quite a bit about outcomes when it comes to novel technologies like this. And it's been exciting to see your startup journey and some exciting partnerships that you've developed. Can you talk a little bit about outcomes, though?
Absolutely, absolutely. And I think that in order to deliver outcomes, first of all, we have to find ways to engage with the population. That's a very big issue, and I think that technologies like ours, what we bring to the market is really this proximity that we have to the user. The fact that we understand and we can detect how someone is feeling throughout the day enables us to deliver real-time support and interventions to those individuals in order to reduce their emergency room visits or unnecessary hospitalizations that actually drive up the cost, especially for chronic disease patients. So what we have seen so far in the clinical and usability studies that we have run over the past few months in terms of engagement is really encouraging. So we see that the fact that we can detect the emotional state of a person drives 90% of the engagement of users in our program, and we see them interacting with our solution over 40 times per week. So they're checking their application 40 times per week. And out of those 40 times, 15 on average, they are performing a mental health exercise. This is significantly higher from what we have seen in other solutions, that they don't integrate real-time intervention that is based on specific data from the user. And that's actually what really drives outcomes. Because as I mentioned before, we only provide 15-minute interventions, 15-minute sessions with our providers on a weekly basis instead of 60 minutes. So although we have reduced the time of psychotherapy on a weekly basis, because we increase this frequency of interventions, we see that the outcomes are extremely good. So in our program, within a period of 4 months, we have seen improvement in depression and anxiety close to 70%, basically moving people from moderate depression to mild or healthy within a period of 4 months without any medication. And we specifically selected individuals that were not suffering from severe condition because we wanted to make sure in that study that It was not the medication that drove the outcomes, but it was the therapeutic. And we were able to see significant improvement towards that. This is very similar results that we would expect to see in face-to-face therapy in that period of time. So what this tells us is that this timely intervention, this proximity to the user, really works and can deliver very good outcomes as well.
Mm-hmm. Neat. Yeah, it's just even watching that, it sounds like you're really empowering the consumer to be able to put in practice some of the coping skills that they're learning, and at the same time reducing the time from the clinicians to help them see more clients. And so super interesting. As I was watching that, I have to ask, how has coronavirus impacted end users, how you're deploying care, really anything?
I think just to add to your point about how we empower clinicians and psychotherapists, psychiatrists, and improving their clinical efficiency, I think this is critical, especially in times of coronavirus, because what we have seen happening over the past few years is that we really have a shortage of providers in the mental health space. People have to wait for 4 months until they see a psychotherapist. In many areas, especially rural ones, they don't even have the chance to visit one psychotherapist, or we might have one psychiatrist for the whole county. And in order to bridge that gap, we need to empower clinicians and give them some superpowers in order to be able to handle more at the same time. Unfortunately, we cannot clone them, but we can give them data and support in order to make sure that they can see many more patients at the same time. I think this is going to become even more important because of the because of the challenges that we're facing today, because of COVID-19. What we saw in the physical health pandemic that is happening over the past few months is that the health systems reached their limits. They were not able in most of the countries to actually provide care to all the people that needed that care. And because we expect a mental health pandemic happening in the next few months, we believe that actually our health systems are going to face the same limitations when it comes to managing and caring for the mental health of their members. And especially in that context, the need for data and technology to support those clinicians will become even more important. And I would say that over the past few months, we have seen a significant increase in the demand for mental health services and support. For that reason, we developed a new program that is called Relief, and is already available in the US and soon enough in Germany as well. And this program is focusing on alleviating the stressors caused by COVID-19. This is a program that is not only focusing on individuals that have a diagnosed mental health condition, but also to the general population that is facing significant anxiety because of the current situation. Over the past few months for our company have been extremely busy. We developed a new program in just a few weeks, and we were very happy to see how warmly it was adopted by individuals already. I think that we also have seen significant interest from employers and health plans in order to adopt in a much faster way the new solutions for their populations. And of course, they anticipate a significant increase in mental distress over the next few months, especially I think as we're getting out of this quarantine and we're getting back to work. How are we able to perform in an environment that we know that it's no longer safe? How are we going to manage the trauma has been created because of COVID-19. We saw in previous epidemics or pandemics that the mental health implications of those were measured in decades, not years. A good example is the case of Taiwan and SARS. SARS hit Taiwan 20 years ago quite hard, and the impact in the mental health of their population is visible even today. 10% of the whole population never took their face masks off 20 years after the epidemic happened, right? So we can only imagine the effect of this pandemic to the mental health of the population globally for the next decades.
Yeah, at least. Wow. Well, we are already running out of time so quickly. I have plenty more questions I'd love to ask, but it's just been remarkable, George, seeing how much FEEL has evolved since we met over the last couple of years. And we've got all sorts of stakeholders in the audience. Do you have any advice for other startups or health plans and how they can partner better?
Thank you. Of course, we have had a lot of learnings over the past few years. I think that I would advise every entrepreneur that is going through the health plan or the health system route to have a lot of patience, because those relationships take a very long time to develop, and also focus on clinical outcomes. I think that's the only solution going forward. And in our field, overall in healthcare, I think that the rules of thumb that are actually applicable in other startup areas, like move fast and break things, do not apply here. In healthcare, you have to move slow and try not to kill people. And I think that's extremely important, especially in times like this, where the need for new services is more important than ever. So I would advise them to have a lot of patience, but also advise them to focus on clinical outcomes and actually adding value to the end user and patient.
Mm-hmm. That's great advice. Yes, thanks so much. And everyone, be sure to check out the FEEL booth in our sponsor page. Definitely want you to learn a lot more about the great work that George and his team are doing. But George, thanks so much for joining us.
Thank you very much, Salome, and thank you for organizing all this. It's pretty amazing.